So this is a 20-minute demo of key features. It's including a quick demonstration of GP Connect. If you're particularly interested in GP Connect, we have a webinar we did yesterday, which we do have a recording for, which I will put into the thread once I stop talking, so you can go and look at that. CareLineLive, if you are not familiar with us, we're award-winning, all-in-one cloud-based home care management software for home care providers. So we're an NHS X assured supplier, so we're one of only a handful of home care software providers that have that accreditation. I'd say that the thing that marks us out very differently to the rest is our focus on customer support. We answer the phone, we respond to emails, we respond very quickly to Intercom, our message-based system. Our customers love our customer support. If you look on Trustpilot, you will see how positive people are about our support service. So who are our customers? Well, you can see a variety of logos there. They range from little new startups with a handful of carers through to much larger home care providers and franchises. We also have a number of NHS trusts and other NHS related, I'm thinking about, we've got customers in Northern Ireland. They're not technically NHS trusts, but they're big public sector providers in Northern Ireland, as well as a lot of local councils. One quote from a customer, Alice Allen from North Shropshire Home Care, says, "I didn't realise how difficult paper-based systems were until we went digital. We've got more time to be focusing on management, admin and auditing. CareLineLive has cut a lot of processes down by at least 50%. And with more time saved, we can take on extra packages." And I actually interviewed Alice yesterday about GP Connect, and she says they are saving something like 3 or 4 hours a day by using GP Connect integrations. So that's part and parcel of what you get when you're in England and you sign up for CareLineLive. So you could enjoy that, anticipate that as well as part of your subscription. So what our customers have in common, they are all busy, they're all time poor, they're often stressed. Hopefully, I mean, it's not good for you to say, yes, that's me, but we all know in this sector that probably is you. They're struggling with rostering, paperwork, inspections and calls and demands from service users, friends and family. They're in a continuing cycle of recruitment and retention, and then having to train those new recruits. And CareLineLive does help with assisting in breaking that cycle, and it will help you with your retention as well, because carers really like using it. Customers are often very concerned about costs. For a lot of our customers, we actually save them money, and our product is not super expensive either. We have very clear and transparent pricing too. But customers are often concerned about change, learning new software, and I hope from this demo, Chris will demonstrate how simple it is to use CareLineLive. We have customers that say, I was a digital dinosaur, and my carers were really concerned about this, but they find it really easy, and you know, with a couple of training sessions, they're up and running. So it's absolutely fine if you are not tech savvy. Go onto Trustpilot to have a look at what people are saying about us. These are just some recent testimonials. I'm not going to take up any more time of the demo going through that, but I'm going to introduce you to Chris Ryan, who's one of our sales managers. His contact details are there. I'm going to stop sharing my screen and Chris will jump on and do the demo.
Thank you, Marie, and good afternoon, everyone, and thank you for coming along. Obviously here to give you a quick snapshot of our home care software. I'm going to start off demonstrating the mobile app first. This way you can get a good understanding of what the carers are able to view and what they can record and so on. As Marie mentioned, usually these demonstrations take up to about an hour. If you'd like to get in touch with us about arranging a more detailed demonstration after this, we'll be more than happy to get that arranged for you. So the mobile app itself, it works on all Android and iOS devices. It sits on the home screen like any other app. Ours is one on the bottom line there. So mine's configured to use facial recognition as a password. It dependent on the device, it can be a fingerprint or a passcode. The benefit of the app is they can see their day-to-day visits. They also get real-time updates and notifications. So these green ticks are indicating to us these visits are completed. If I scroll down, we can see a visit's been cancelled with Steve Perry at 6 o'clock. But as a maximum, the carers can see up to a month's worth of visits in advance. But once you're making any changes in the back office, the app will update. It will also send them a push notification because it's also informing me the visits with Elizabeth and Karen have changed to later in the day. So I'm going to log into Sarah's visit here. On the overview screen of the client, we're welcome with their address and key safe access information. We can also see a care package summary note. So you can write a brief overview of the client's medical conditions, any likes and dislikes. Also, there's an ad hoc note here just to tell the carer the key safe's at the rear of the building, saves them having to phone the office if they're unfamiliar to the client and unaware to see where they can find that. There are two methods and way they can log into the visits as well. So the way I do it, you can disable. So when they initially press the check-in button, it opens up a camera and they can scan a QR code, which each client has in the CareLineLive software. Or they can press a manual check-in button, as I have done so there. Both options do grab their GPS location at the point of check-in and check-out. I will show you shortly in the management platform that we will flag up where carers are logging in too far away. My app is configured to inform the office if I'm more than 10 meters from that location, but you can reduce that further if you wish. There are two other parameters that they fall out of, is the punctuality and the duration. So if they significantly under-deliver, we will flag that up for you. We have three other tabs at the top. So we've got the tasks, which is the next tab along. The third one is the notes. So the carers can see any historical handover notes left. So the last carer to visit Sarah here has just left us a note to make sure we check on her blood pressure and make sure that she's drinking enough, so handover notes can be left, and also read-only access to any documents, which we will be showing you shortly. We do have care plans and assessments built into the management platform. Once they're completed, they can be uploaded to the app for carers to have read-only access. You're not restricted just to our documents. If you've got any external documents you wish to upload for carers to view, you can certainly do that. But I can complete the tasks through the app here. So we've got some aspirin to prompt. We can see this was last prompted at 12:42 on Monday, the 9th of December. So more than enough time has passed since that medication has been prompted. When they click onto that and open up the status, it will bring up all of your standard Marsheet responses. Now, CareLineLive is very customizable. I will show you that shortly. I mean, you can amend all of these response types. If you want to add further ones or remove them, you can certainly do that. So we can click that off as completed. I can leave any comments, which will also populate the Marsheet, and check that off. You can also specify which responses require comments. So if any medication is refused, for example, and the carer doesn't explain why, it simply won't let them move on. We want to know why this wasn't completed, why it was refused, but completed will allow them just to move on. The carers can also report concerns through the app. So if there's any adverse reactions to this medication specifically, there's a slider at the bottom where I can just pop in a brief note into here. I'll write something like felt dizzy after medication, for example. That will pop an alert in the office, and you can create a detailed incident report off the back of that. Got a general task of cleaning the kitchen area and living rooms and so forth. And the app can also be configured to prevent care workers checking out if they've not completed all the tasks and medications. As well as tasks and medications, the carers can also report on various observations. The meals, they can record directly into here what meals they're prompting them. Some of my clients, this one doesn't, unfortunately, that can link to our inbuilt assessments, and it can actually show a drop-down list of what their preferred meals are and meal times in there. So if you do regular meal preparations for clients, you can populate that in one of their assessments. We can monitor fluid intake. We've got a couple of prefixes here of a cup and a pint. They are able to type in a different amount if it's necessary. Multiple observations can be captured during the same visit as well. So if you are doing longer visits rather than short, say 15-30-minute visits, multiple fluid observations can be captured. Similar with blood pressure reading. So the previous carer had mentioned just to check on this. So I can type those readings into here. And again, if it's a high or low blood pressure reading, I want to report that as a concern to the office. I can report that as a concern down below. You may have noticed a little camera icon here. This can be disabled if you don't want the carers to do it, but they are able to take photos through the app. Should they take photos for security reasons, they're not saved to the physical device or the personal camera roll. They are pinned against a client journal. We can also capture observations such as catheter changing. So you'll find a useful color chart in here to record the color of the output. the amount as well. We've also got the ability to record the likes of weight, heart rate, even bowel movements in here. If it's a service that you carry out, we've got all the stool types and descriptions pre-populated here, followed with the stool size, if a pad was changed or not, and then save that off. But then once everything is completed, the carer simply move to the checkout screen and scan the QR code again. So it's informing I have no outstanding tasks, so there's no issues there. If I had missed off any tasks or medications, they would show up here and prevent me logging out. Here is where I can leave a handover note for the next care worker. So I can just say, check that Sarah is drinking enough. So the next care worker will see that note. And overall visit notes as well. This section you can make compulsory. So if I try to check out without writing anything, it simply doesn't let me. You can even stipulate a minimum word count in here. So if you do want a detailed 10, 20 word overview about how that visit went, even if it was good or bad, they'll have to do that. But mine's only set at 3 words, so I don't have to write too much. So I'm just going to write Sarah was well. That's my 3 words. That's let me check out. And that visit's now ticked off and completed. And my next visit's at 20 past with Karen. But again, even before I've checked into the clients, I can just familiarise myself with their care package summary overview, what tasks I need to carry out if notes have been left from previous care workers, and access to any documents. If you want to as well, you can actually hide all these task notes and documents until the visit is actively in progress. So that information would not be visible until they've actively scanned the QR code or started that visit. So that's the overview of the mobile app for you. So I'm just going to close that down and actually open up the management platform for you now. Whoop, there's my desktop. There it is. Right, so the software itself, just like many others, ours is cloud-based. It's hosted by Amazon Web Services, so you only need an internet connection to gain access to the software. When you do first log in, you are welcome with the dashboard. This generally flags up any items that need your attention in the coming weeks. So it will flag up any, say, client and carer birthdays this week. It does show up on the mobile app when it's a client's birthday. It has a little birthday cake icon next to their name. Any carers on leave this week, but also anything you've entered into the system with an expiry date can flag up here. So it's not just qualifications. This can also be like appraisals, DBS certificates and so forth. So we have these items expiring this week, but I can check for the rest of the month. So here we've got driving licenses, DBS certificates and vehicle insurance, as well as some qualifications. I can even go as far as seeing next month. We've got 3 items expiring next month, and all of these client and carer birthdays are due as well. A bit further down in our tools section here, we do have a care worker training matrix. So you can export that into an Excel format, but you can also run standard reports if you want to look at expirations over a longer period. Below that is a list of alerts, so we can raise alerts for late and missed visits, missed tasks and missed medications. These can also go to designated email addresses as well as the software, so even if you're not logged into the system, you can still pick up these alerts via email. We can also send push desktop notifications, so similar if you're not logged into the system but working on your laptop, they can pop up in the bottom corner for you, and they can be configured to be raised, say 5, 10, 15 minutes after the planned time. It's entirely up to you. And the concerns I raised through the mobile app, you can see, have come through. From here, you can actually open these up and start a detailed incident report. I won't go into too much information on here right at this moment, but it does follow the CQC's key lines of inquiry when you get to the outcome. So it will allow you to write any lessons learned responding to that incident, demonstrate how it was dealt with safely, effectively, in a caring manner, and so on. If it's injury related, you can also add an annotation to a body map from here as well. The roster screen gives you an overview of all of your visits scheduled for today. So we have all of your carers down the left-hand side. It has drag and drop functionality, so it's really useful to reallocate visits if carers are called in sick or been called away on emergencies. We've got unallocated visits at the top here, which can just simply be dragged and dropped to an available care worker. And when you click preview and save, that will send them a push notification that we've added that additional visit to them. It's only going to have done it for that day and that day only. These red ones here have been cancelled. These light green visits are completed. They are also compliant, so we know we don't need to investigate those. Anything you see with a blue line above it, that's what we call rounds. Some call them runs. So if you want to group your visits together in geographical patches, for example, you can allocate the certain visits to runs or rounds rather than individual bookings. The big red and green lines you're seeing just showing if you're allowing enough travel time in between those visits. Well, hopefully none of your carers do have to travel 132 miles to their visits, but somebody clearly is there. And if you see any blue ones, this is flagging up that they're potentially fraudulent. So these have fallen out of either one or three of the parameters. I can actually investigate those more in the unconfirmed section here. So hopefully none of your care workers will do this, but if they are logging in too far away or not staying the desired duration. So this is a visit I've logged into with Sarah just a moment ago. So the two warnings it's fallen out of it is the duration. So I've actually arrived on time, so there's no issues with that, but I've only stayed for 4 minutes and 57 seconds of a 15-minute visit. But also I'm just sat in the comfort of my own home here, 793 meters from that client's home. So if I'm more than 10 meters away, it will flag that up. So these don't get pushed through to payroll either unless you've authorized them. So if any carers are trying to pull fraudulent visits, they are flagged up in here for you to investigate. Account section will just be all of your office staff, your care coordinators who have access to the system. Just for reference, you can separate your clients and carers into teams. So I can only see my team when I log in. I can't interfere with any clients and carers I'm not responsible for. And you can also configure what permission levels they have when accessing the software as well. So we have all of the aspects of our software down the left-hand side. Just for ease, I've just used alerts here. But if you don't want branch managers doing anything with alerts, you quite easily turn those permissions off them. Give you a quick overview of our care worker record. So we will have active and inactive. You can always email them a copy of their agendas as well, or print them off a hard copy. And then we've got contract types, so we can also help populate pay rates. So in here, you can have as many pay rates as you like. So if you are paying different rates, depending on the skill set of the care worker, or the visit type, for example, we can certainly help you with that. So we have a default hourly rate configured here. We can do non-pro rata rates if you do offer the short 15-30-minute visits. Also any unsociable hour ranges. So if you're paying the carers more for visits on Christmas Day, public holidays and weekends, the system will automatically pick up those rate uplifts for you. Or if you pay any carers a fixed rate each week or month rather than hourly, we can calculate contracts in that fashion. And if you pay mileage and travel time or one or the other, we capture those as well through Google Maps for payroll purposes. So again, we can include mileage from their home or exclude that, exclude the first 5 miles of the day. You can even do different rates per mile depending on the mode of transport they use. So we can certainly help to look at replicating your business rules in terms of invoicing and payroll there. So I'm just going to open up my care worker record, not in the pay rates. That will be found here. So the first few screens of the carers is quite self-explanatory. So the overview will just show you all of their contact information, any reference numbers. So payroll DBS numbers can be stored in here, all of the care workers' contact information as well. You can inform the system what their desired schedule hours are. So this is my availability for week 1. I have a slightly different availability here for week 2. This can be increased by the number of weeks here. So if you have any care workers who have like a 4-weekly pattern, you can specify that. We can also record absences. If you wanted to, we can look at calculating holiday pay based on hours worked. We've also got a section for document storage for your care workers. So if you do want to upload copies of, say, their passports and driving licenses, they can be easily uploaded into here. You can put tags on them as well. So if I just want to look at his driving license specifically, I can specify that, or his DBS certificate. Previously exported pay slips can be exported and provided to the carers. And now we calculate everything to gross. We're not a complete accounts package, but we do provide standard CSV export files, which are compatible for the likes of Sage or Xero. So we've got the total hours worked and my gross pay. We've got my mileage payments below that as well. I don't get paid travel time and I didn't take any leave. And then there's a fully itemised breakdown of each individual visit I carried out, including any mileage payments as well. So these can be shared with the carers with as much or as little information on as you like. Oh, sorry, I just navigated away from there accidentally. Let's open that back up. And then also the requirements section here. So any items you enter into this section, these will flag up on the dashboard with at least a 2 months notice of expiration. So any items like qualifications, driving licenses, DBS certificates. So if you do want to be informed about expiration dates, the dashboard will certainly do that with at least 2 months notice. You can also specify the training and qualifications that they've achieved. Again, in this drop down list, I think we've got them all covered. If we are missing any, you can certainly add further items into there as well. You can also have access to the Care Workers app see what when they were last active on the app, that they're on the latest version. So you can see I was active 9 minutes ago there, but you can delete their access here should any care workers leave, or if they feel the app's been compromised or the app's been misplaced, you can say change the password from here as well. There is also a soft timeout authentication you can configure on the app. My app kicks me out after 10 minutes if I don't interact with it in any way, prompting me to enter my password in again to open that app up. So just in case if I do drop it on public transport or leave it lying around, there's no risk of it being kept logged into the app for somebody to pick up and gain access to vulnerable people's information. Okay, so I'll move over to the client section here now. So again, we do have a list of active and inactive clients. If they want to know who's coming to visit them and when, you have the ability to email them or print them off a copy of their agenda. Alternatively, we do have what we call the Care Circle, which is a free to use friends and family portal. From there, the clients can actually log into that to evidence care delivery. They can see historical visits, up and coming visits, the notes the care workers are recording, even observations. So if they take regular blood pressure readings, that information can be visible through the Care Circle. You can restrict what certain people can and can't see when configuring the Care Circle access as well. Service contract types here, so this will be all of your invoice rates. So again, you can have as many invoice rates in the system as you like. Clients can have multiple rates allocated to them. They can also have multiple buyers allocated to them. So if there's any circumstances where you need to invoice local authorities rather than the client for certain visits, we can help separate those invoices for you. But again, we've got a default hourly rate of £25 an hour for these services. Non-pro rata rates again can be applied. So if you do offer the short 15-30-minute visits and what you invoice for those, call out charges can be applied. And similar to the pay rates, we can preempt any rate uplift for visits on Christmas Day, public holidays and weekends. Or if any clients are invoiced a fixed rate each week or month rather than hourly, again, the contracts can be configured in that fashion. Oh. Sorry, my headset just died there. I'm just going to unplug that. So I'm just going to open up Daniel's record here. Okay, so on the overview screen of the client here, we get access to all of their contact information, including their important contacts, their GP surgery information here. Any items you write in this section here, this is what's visible on the overview screen of the mobile app. So as mentioned earlier, there's no character restrictions in here, so you can write as much information about the client's medical conditions and likes and dislikes, etc. A section for any reference numbers as well. Profile is quite straightforward, just their email, telephone and postal address, but the people is where we can upload their important contacts. So we do have a section in our software called People. It's just down the left hand side of the navigation bar. In there you can set up what we call global contacts and global buyers. So if you took on a new client and they go to the same GP surgery as other clients, you'll find them in a drop down list, so you don't have to type that out several times manually. It's similar to the buyers. So if there's a regular local authority that you work with, for example, you can attach them as a global buyer. If you take on a new client from that council, you can just choose them from a drop down list rather than typing that information in several times. Care worker compatibility, so you can also make sure the most suitable and reliable carers are allocated to him. If he wants to exclude carers, say based on their gender, maybe he doesn't want male or female carers, all females now will be excluded from him. So the software now will only let you allocate male care workers. You can even say only send carers that have a specific qualification. So if the client does require something similar to like moving and transferring, if the carers don't have that qualification, it simply doesn't allow you to allocate them as they're not suitably qualified. So you can always ensure the most suitable carers are allocated to him. Now the agenda and schedules, they're both sort of similar features, but the agenda here is where you can make ad hoc changes to the client records. So let's just say Daniel wants to cancel this visit for tomorrow morning. I'm not going to charge him as he's given me enough notice, but that won't have like any impact onto his visits for the next week. So we have nudged a few visits around already this week by the client's request, but if I can skip over to next week, you'll see all of his visits are all in line, all back in uniform and back to normal, similar with the week after that. So it hasn't had any knock-on effect to any future visits there at all. So again, these light green visits are completed and compliant. I do need to investigate this one because it's flagging up blue. So you can see I only stayed there for 5 minutes and 8 seconds. And I've also checked in ridiculously far away, so over 30,000 meters to be precise. You can add in one-off ad hoc visits as well. So maybe if Daniel's called you to say if anyone's available to pop in on Saturday morning just to help him with some housework or gardening duties, we can just add in a one-off visit on his request there. But any permanent changes or additions or deletions you need to do, you do that in the schedule. So this is the master copy. So anything that you add or change or remove in here would be permanent. I mean, we can amend existing visits. You don't have to delete them all and add them all back in again. If he just now wants this visit to start at 7 o'clock rather than 15:15, I can just amend the time. It'll nudge all the visits back by 15 minutes, but that's permanently changed. It's not just for that week. So forever going forward, they're now scheduled to start at 7 p.m. And to add in new visits, we simply click into here. If it's every day of the week, you can quite easily select them all. But if it's just on specific days, we highlight those. We then have the start time, the duration, the booking type, again, just our descriptions in here, but you can add further items into this drop down list. If you need to allocate this to an existing run or round of visits, they'll be visible in this drop down list. So if you want to group it into an existing run, that's visible there. If that's unchecked, it's just an individual booking. And if they have multiple rates as well, you can specify who it is that gets invoiced. So if I do select this council contract, Daniel won't get invoiced for those. Now this raises a separate invoice for the local authority. But if I do want to invoice him, I'll specify the private rate. And when you come to selecting a carer, as you continue to use our system, it filters the carers by continuity of care. So it shows you the most frequently visited carers at the top here. I mean, these carers you can allocate, but they've just never visited this client before. Any excluded carers are greyed out at the bottom and can't be allocated at all. But I can attach Adam to that visit and click create. And then once that's in, Adam's allocated to go and see Daniel Monday, Tuesday and Wednesday. Forever going forward. Obviously the changes you'll need to make is if Adam goes on annual leave or goes off sick, you just need to put ad hoc cover in his place, but we've now scheduled Adam to do those 3 visits each week. Daniel's only got a weekly schedule here, but again you can increase the number of weeks. So if he has a visit every other weekend, or maybe I do week 1 and Marie does week 2, you can schedule that pattern, which will continue to roll on that 2-weekly cycle. Anything that you delete from here is permanently then deleted and no longer active going forward. We could also see below that a list of all the tasks and medications we have allocated to this client. We can export a hard copy version of his mark sheet from here as well with the completion codes. For reference, there is a section where you can bulk download all of your client mark sheets all at the same time, but just for ease of use, I'll show you this one. We're obviously only 12 days into December, so there's going to be some gaps here, but we're getting the completion codes, the carer's initials and the time the medication was prompted. This one here on the Friday last week, that's got a cancellation code in it. That's why there's no carer initials, so that visit was cancelled. But up to date, everything has been completed. Obviously, the ones later on this afternoon are not done yet because they're far too early. So that automatically updates as soon as the carers record that information. Similar to any notes that they record through the app, they are made visible through the client journal. So you can filter this screen by visit notes, handover notes and checkout comments, but you can also record direct communication with that client. Again, customizable categories in here, so you can, for reporting purposes. So if he has called the office with a complaint, it will date and timestamp it. So if you want to run a report on all complaints raised by all of your clients over a certain date range, you can certainly do that. And here is it where you'll find our care plans. So we do have various sections. We've got the care plan itself. We've got advanced statements in here, and we can open this up just to edit it if we need to. But we can already see that Daniel's given us a brief statement that he likes to be cared for in his own home. He'd like to gain more independence by carrying out tasks himself, such as meal preparation, walking to the shops to buy a newspaper. He does need to be reminded to take some medications from time to time. But the care plan here, again, we can specify that he does have a goal to prepare meals, which is quite important to him. He's making some progress towards that. We've also got additional support plans. Contingency plans can also be entered into here. Below that are 20 inbuilt assessments. So again, these can be completed through the management platform. I won't go through all of them, but just give you a quick overview that you can see one relating to their communication, got one for conditions and needs, which has already been populated. So just for reference as well, it does have smart lookup. So we've got all sorts of general conditions in here. But if he does have, say, kidney disease, for example, I just need to type KI, don't write it in its entirety. It's brought that up as a suggestion, so I can pick it from the drop down list. Similar with cardiovascular, mental health and mobility concerns can be logged in here. We've got environmental risk assessments built in here, so we can go around each area of the home, so around the bathroom, just making sure that it's clean, it's free of trip hazards, safe grab rails and bath mats are in place there. Got a section for comments, and you could do the same with the toilet area. Got a section for the kitchen, also the bedroom, living room, hallway and outdoor space. We've also got mental health, mobility, moving and handling assessments all included in here. The choice is showing that Daniel has an integration with GP Connect. That information can be found a bit further down below here. So we can actually see recent summaries here and historical encounters on the client, or linked from the GP records. A list of like clinical items, problems and issues, allergies and adverse reactions. So we can see way back in 2018 here, we had adverse reaction to gluten-free cracker toast. Also what medications he's being provided, quantities and dosages of that as well. So that automatically updates as the GP records are.
Chris, can I just give you a tiny bit of warning? We are at 13:30 now, so if you could wrap up in a few minutes, that'd be great. Thank you.
No problem at all. Yeah, so just to cover other things, documents, any documents you upload against a client, once they're uploaded, you can then just specify if they're visible on the Carers app or the mobile app as well. And then we've also got the markers where you print off their QR codes. This is where the unique identifier of the clients. Finance shows you all their previously exported invoices as well. And then we've also got the section for the Care Circle. So anyone who wants access, you simply pop in their email address, which sends them an invitation. And just for quick reference, you go to the Care Circle settings to specify what information they can and can't see. So if you don't want them seeing information such as documents and carers notes or the carers names, you simply just uncheck those off there. And as well as that, we've got access to a whole host of standard reports available, so you can actual hours against what was planned, like punctuality reports, like client journal reports, if you want to run reports on all complaints raised, like missed medication reports and so forth. And the settings generally just allows you to customize the software where you want to enter items into drop down lists. So if we are missing, say, qualifications, for example, you can simply click on the plus there, write the information, and it's instantly available in the drop down list. And also lots of configuration to the mobile app, such as disabling the manual check-in button, number of words you'd like on the checkout comments as well, and the soft authentication in terms of when the app times out. So yep, and other than that, you can also gain access to our support team through here. We've got a live chat system through here, but you can also contact the support team via email and telephone for any support and help free of charge. So yeah, so I think I've just about covered everything as quickly as I can. Sorry if I overran, but yeah, any other questions?
You covered so much more than I was expecting in that time. Chris, I think you got interrupted just when you were showing body maps. Do you want to just quickly just show that screen?
Yeah, we just for reference as well, it is in our development roadmap to get this body maps pushed out to the mobile app. But once you've completed one, you can export it and upload it to the app for carers to view. But again, we can just add in any annotations such as injuries, medications and so forth directly through here. Yeah, so we do have body maps built in, but we are currently working on getting that pushed out to the mobile app. We don't have a definitive date as of yet, but it is in development at the moment.
Thank you very much.
Thank you.
An absolute rammed, very informative whistle-stop tour of CareLineLive. Does anyone have any questions? Please put them in the chat if you do. I did put a little link to our GP Connect demo, so you can sort of look into that into a little bit more depth and understand all the benefits that one of our customers that's been using it for a few weeks is reporting. As Chris said, if you'd like to have a more in-depth kind of tailored demo to your needs, please just get in touch with us. If you go to the website, you'll find a book a demo button, and you can just book it online, or you can give us a call and we will get that set up for you. Just watching to see if there's any other requests. Oh, and Nick has actually put a link to the demo booking into the thread here. Okay, well, I'm assuming there's no questions there. So thank you so much for your time. Thanks very much, Chris, for joining us and sharing your knowledge of the platform. And yeah, any general messages, any other questions, please use sales@CareLineLive.com. Okay, I'm going to close the meeting now, wrapping up. Thank you very much for coming, and we will look forward to seeing you at another webinar, I'm sure.
Thank you, everyone.